Hello, 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 everyone. We are going to give you all some time to come in. Hello, ladies. Thank you all so much for taking the time to join Mean Girls panel discussion as it relates to women in healthcare. Those of you who are on the line, we want to just say this is still Women's History Month, and we are celebrating women all month long. So, Mean Girls Empowerment has dedicated this month to celebrate women in healthcare. So I'm going to give it some time so we can get some viewers on. It looks like we have a few people watching us now. Those of you who do not know me, my name is Shatina Edwards, and I am the CEO and founder of Mean Girls Empowerment. MEAN stands for Manage Emotions, Avoid Negativity, and we are an anti-bullying organization empowering girls to avoid negativity, build self-confidence, and pursue their goals and dreams through confidence, courage, and creativity. Mean Girls has been around since 2014, and we are here to stay in the community. So if you do not know anything about our organization, I definitely ask that you take a look at our website. You can find us at meangirlsempowerment.org. Again, this month is Women History Month, and we have brought on a few healthcare executives that some I truly admire, some I actually just met. And we are going to be talking all about healthcare today. We want to find out what these ladies are currently doing in their lives, and they're also going to give us some advice on, how we can pursue or how you can pursue a career within the healthcare industry. I had the privilege to work in the healthcare industry for the past 13 years, and currently I work as a manager with a managed care organization here in Illinois, and I have a passion for healthcare and to serve individuals. Basically, going to school, I pursued a master's and a bachelor's in health administration. And so health has always been a passion of mine. And Mean Girls Empowerment, this year, we are really pushing our health initiative. So ladies, thank you all so much again for joining. I would like to introduce this amazing panel of women. So first, I would introduce Beth Griffin. She is the COO of Healing Hands Resource Center, which is a mental health facility. Welcome to our panel, Beth. Thank you so much for joining us today. Beth, it sounds like we can't hear you.
Hello, Mean Girls. I'm glad.
Hello. Yes, welcome. Next, I would like to introduce Kanita Johnson. She's our very own. And also, Beth is our very own as well. But Kanita Johnson is the Director of Quality, Safety, and Health Policy. Hello, Kanita. Thank you for joining us.
Hi, awesome. Shatina. Hi, Mean Girls.
Hey, we're happy to see you today, girl. All right, and we have Tarkisha Hammond. She is a licensed clinical professional counselor, and she also manages health and wellness programs. Welcome to the panel, Keisha. Thank you so much for joining us today. And then,
thank you. Hi, everybody. I'm happy to be here.
Hi. Thank you so much, Keisha. And lastly, we have Tashika Townsend. She is the Director of Illinois Provider Performance. Welcome to our panel, Tashika. Thank you for joining us.
Of course. Thank you for having me.
Absolutely. So, ladies, let's dive right into the discussion. We only have about 45 minutes, and I want to hear from you all today. So I'm going to start with you, Tashika. Can you tell me about yourself and why did you choose the field that you are currently working in today?
Mm-hmm. Sure. Thank you. First of all, I want to thank you again for extending the invitation to have me here today on this panel with all these lovely ladies in the healthcare field. So again, my name is Tashika Townsend. My educational as well as professional background is in healthcare. I have a bachelor's degree in community health from the University of Illinois at Urbana-Champaign, and a master's of public administration with a concentration of health services management from Roosevelt University here in Chicago. I've worked in the healthcare industry for just over 25 years. primarily on the payer side, which is where I am today, but I've also worked on the provider side. I initially had a desire to work in the field to ensure that the underserved and the uninsured had access to health care. Also to educate people on health-related services that are available to them. My main focus over the past several years have been with government program products such as Medicare and Medicaid. And I work with various provider types to build a network of providers, educate them on our policies and procedures and how they are performing so that they in turn can deliver quality care to our members.
That's amazing. That's amazing. Thank you again, Tashika. I know all about what you do. I also work in that same spectrum as you. So thank you again. Kanitha. Kanitha girl. Quality health policy. It sounds like you're doing a lot. So I want to know more about you and what you do.
Thanks so much. Again, I echo Tashika's comments. We appreciate you having us today. And I know one day we're going to be talking to some of the mean girls and they're going to be right in this same predicament, leading the way in healthcare. My name is Kanitha Johnson. I am the Director of Quality, Safety, and Health Policy for a trade association representing the vast majority of hospitals in the state of Illinois. I can say that I did not start this journey in this way. I initially started off as a nursing student. I went to school in New Orleans. I came back home and I was greatly impacted by things that were happening during Hurricane Katrina. And I thought to myself, as a transfer student, how do I get my life back on track? And in all good things and in all weird things, God has his own plan. We just have to walk in his vision. So I found myself working in community-based grassroots program, doing HIV outreach with the LGBTQI community for a while. And then I started saying, okay, what is emergency preparedness? What is disaster preparedness? What should happen if everything goes wrong? And that's pretty much how I landed where I was. I got a bachelor's in community and community health and health promotion, got my master's in public health. And from there, I just kind of navigated my way through healthcare, understanding that, and I know we're going to talk about later, that some of the traditional roles that as African Americans, we only know we were not introduced to. So I'm so happy to be a part of this panel, and I'm open for all questions and comments and looking forward to talking to everybody. Thanks, Shatina.
Awesome. Thank you, Kanitha. Beth, hello, Ms. Beth. Beth is also serves as the chairman of Mean Girls Empowerment Board. So, Beth, we are excited to see you in the camera because behind the scenes, sister, you always working. So, tell us about yourself and what do you do in your professional career?
Hello, I'm Beth Griffin, and I'm not a in the front scene person, but you pushed me to that point now. My professional career is healthcare management. I was a manager in, I'm going to say Advocate South Suburban Hospital at Christ Medical Center for 25 years. In that, I was on the revenue side. And a lot of people probably don't know what the revenue side is, but we are the purse of the hospital. So I'm that person that you would see. My staff would be the registration staff coming into the emergency room. It would be the outpatient staff, as far as lab, radiology, admitting, and we're also responsible for setting the prices in the hospital. So that's the side that I'm on. We're involved in a lot of the hospital, so you get to know.
It sounds like, Beth, your audio cut out, and so we will definitely get back to you as it relates to it. Beth, are you able to hear us?
I can hear you now.
Okay, you cut out a little bit on us.
Okay, so we're the side of the hospital that many people don't know really exist. Okay, that was my first That was my first journey. Currently, I work as an independent contractor. Technically, I'm the COO of a community mental health center, and it's similar to the same person, the community mental health center, where I'm over billing, um, networking, scheduling, and different areas of that business.
Awesome, Beth. Thank you so much. And we are looking forward to hearing more from you as well. Keisha, hey girl. I am so excited to have you on. I've heard so many great things about you. And so I am interested to hear more about your journey, and go ahead and introduce yourself and let us know who you are.
Thank you, Shatina. And I'm so happy to be here. My journey was a roller coaster getting to where I am now, but I made it. So let me just start off a little bit. I was going to nursing school. I went from business to nurses, wanted to go to nursing school, finish the curriculum, everything to get to nursing school, and couldn't get in. It was that difficult years ago. It's still hard now. So I was like, okay, I volunteered at a hospital and I hated it. And I was like, I cannot do this. I'm like, I need to take care of people before they get sick. And so what that did, that propelled me into getting my bachelor's degree from the University of Louisville in Kentucky in physical education with a concentration in health, wellness, and promotion. And I love sports. So that was right up my alley. So after that, I'll talk about later, a little bit later, how I got into getting my master's in public health. I completed that at Indiana University in Bloomington, Indiana. And then after working in the field, coming to Chicago and working, doing things like I was managing a children's asthma program. I was working in violence prevention programs in Chicago public schools and in the suburbs. I decided to go back to school and get a second master's in clinical counseling right at the great Chicago State University. Don't overlook that school. It's a good one. And so it was only after I completed that I felt like my career took off, just sparked with that degree. And so when I did that, I decided to merge my clinical background and my public health work. So now I do private practice part-time. I have my own business where I am in private practice. And then I work for a major insurance company, still managing health and wellness programs. And so that's where I am today. And I'm enjoying the journey. I recently started my doctoral program. I'm earning a EDD in community care, counseling, and pastoral care. Yeah, I got that ministry side too. So when she said something about God, I'm like, yeah, you got it, girl. That's what I'm talking about. So yeah, so that's who I am and what I've been doing.
That's awesome. Awesome. You all have great career paths. And I wanted to say what's funny is most of you all say you started in nursing, or you looked into nursing prior to moving into the current field that you are today. Well, I had that same experience as well. I was at Chicago State trying to get into nursing school, and there were a few anatomy classes that I was like, oh my God, I can't do this. And that's what led me to health administration. So that's really funny that you all say that. But I want to ask, what are some steps you would recommend someone to take to prepare for the field that you're in? So Kanitha, I want to ask you first, because your background is just like slightly different. Everybody don't always understand what's health policy and quality and safety. They don't understand that part of the healthcare industry. So what would you recommend someone to take? What steps would you recommend them to take to prepare for this particular role?
Yeah, so let me kind of drill down on probably most of my day-to-day activities. So we're living in the unprecedented time of COVID-19, and literally my job is to manage what to do before these type of events happen. And so what I would say the steps that they should probably start to take is, I agree with Keisha. If you've ever worked in a hospital is not for everybody, but there are so many functions of healthcare that make that system kind of roll, as Beth said. And so what I found is, so in quality, what we're doing is saying, think about when you go into the hospital and you say, hey, I didn't have a good experience. The doctors weren't nice. I felt like there were alarm bells going off every 10 minutes. It's how do we measure to ensure every patient receives the same level of care? And as you know, as African Americans, if you're reading anything in the news, you know that healthcare disparities are one of the top priorities of, nationally and definitely in the state of Illinois, to make sure that we're all getting the same standard level of quality care. From the health policy side, it takes it a step further. It's saying once you identify those places where we have gaps or need to do improvement, what are the laws, the ordinance, the procedures, the bills that we need to implement on a local ordinance level all the way to the state level, to make it a meaningful healthcare experience. So again, I'll take the most simple example of COVID-19. We are past the year of a stay-at-home order. That took some type of proclamation or some type of ordinance to be enacted. And I was proud that my organization and myself, we were part of creating those to say, hey, instead of just saying we have to close the state, let's create a quality metrics where it says, hey, if we have a lot of people in the hospital at a certain time and we're testing a lot of people and we're getting a high positivity rate, it might not be safe to open. So I know this is later, but one of those things I'm proud of is, again, every time we hear Dr. Ezike, Mary Lightfoot, Dr. Awadi, Dr. Ezike on that screen, and they're saying, this is how many people tested positive. This is, how many people expired, unfortunately, and this is what phase we in. That is all part of a quality, safety, and health policy realm of work. So for me, I would say public health, look into things like that, look into things like maybe epidemiology, which is the study of various disease and how do you calculate things, safety procedures, because again, when you go into the hospital, there's a reason those doors open, and sometimes you may hear a fire drill is happening in the middle of the night. Again, it's all to ensure that you're safe in that continuum of care, both inside a hospital and if you're in a mental health facility or at a clinic. So that's kind of where I'm at with my role.
I hear your passion, girl. It is in you. It is in you. Yes, I love it. I love it. Keisha, tell us, what steps would you recommend?
Oh yeah, I believe in the things that you guys are doing now. Talking to people, getting those mentors, talking to your family members, talking to your teachers, asking those questions about, like, how did you get here? What did you do? Like, what did you suggest? I think back on an experience that I had when I applied for college. I grew up in a small rural town with a lot of Caucasian people. I was asked one question about going to college. Are you going? And that was it. Nobody ever asked me anything else. I applied to one college and thank God I got in. But no one ever said, go back and take your ACT. You only need 2 points to get a scholarship. So I am an advocate for young people advocating for themselves, and you only advocate for yourself by asking questions and ask hard questions. So finding the mentors, joining organizations like Mean Girl Empowerment, and getting and connecting with people. It's all about that connection. That's all. And then I don't believe college is for everybody. I encourage it, but there are ways to get into making great money and having great careers and not feeling like you've got to go to a 4-year college. I'm all about learning a trade, those types of things. So whatever your passion is, get out there, ask the questions, and do the research and the homework.
Awesome. That's really good. I am so for like mentorship. I've had so many positive, influential women in my life that have really helped me pave the way to get to where I am today. So I love what you said. Tashika, Bev, did you ladies want to add anything before we move on to our next topic?
I'll just say I agree with both ladies. I was really going to go down that same path as Keisha with networking. I think that's key. Talk to people, ask lots of questions. Kanitha said it best. A hospital isn't for everybody. I think there's so much to do in healthcare, so many settings that you can work in. But you have to figure out what setting is best for you and what setting meets your needs. I think hands-on experience will help you decide where you want to be, or if you want to do something different, or what you like and what you don't like. So if you at least get your foot in a door at an organization, you get exposure to what's available to you. Even after asking and talking to people, it's nothing like being in that setting. So you can kind of see, and then you get a better understanding of what questions you should ask as you continue to pursue the career.
I love what you said, Tashika. One thing I've always been like ashamed of is when I started, working in the healthcare industry, my first job was in food service.
Mm-hmm.
And then from there, I developed to being a clerical assistant. And then from there, working in the medical record department. And
Yeah,
then from there, working in community outreach. And then from
right.
there, just taking each step up the chain. So I totally agree with you. It's all about
Mm-hmm.
networking. Sometimes you have to start small before getting to the top. And so when I look back at my career, I'm like, hey, you did it, girl. I'm patting myself on the back.
Right,
But
right.
I couldn't see the future and what God had prepared for me. And so
Mm-hmm.
I love what you said. I love what you said. So let me just ask Tashika, since I'm already speaking with you, describe the population, the community that you're currently impacting in your role. And you talked a little bit about it, but I want you to kind of go into a little bit more detail on the type of individuals that you guys are impacting.
In my role, we are impacting the provider community. I'm provider facing. So a big part of my role is education, just constant education. And really, we're filtering education and policies and procedures to providers so that they can better service people that are receiving health care. I'm in my current role, my focus is the northern part of the state, but primarily Cook and the Collier counties. So heavily embedded in the Chicagoland area. Um, like I said, impacting providers so that people in the field can get the care that they need.
That's awesome. And Beth, in your role working at Healing Hands Resource Center, tell us about the individuals that you're impacting, the population, the community.
The population, we're Medicaid, we're completely Medicaid providers. So one of the things that we really reach out to is the rural areas, the Medicaid population. It's limited mental health services, and even the reach is so far for a site.
It sounds like you may have some issues with your audio, Beth. And so I'm going to go ahead and just, Keisha, because I know that you do a lot of education as it relates to health and wellness. And so if you can talk about the community that you are impacting, that'll be great.
So most of my career, I've always worked in those communities where there was a health disparity and not a lot of health equity. And we mean by that there's just not, it's not about being equal, it's about being fair. And so we worked in communities where access to care wasn't fair. That there's food, we call it insecurities or food deserts, where not affordable food wasn't, or people weren't taught, how to go into their local grocery stores or even Aldi's and shop for healthy foods, or, and just not comfortable with it. So as Tashika said, the Medicaid population, and before Obamacare, it was even harder because people just didn't have insurance, period. And so with that, then you're working with individuals who are at risk for getting those chronic conditions like high blood pressure, diabetes. And so in our communities and Black communities that are impacted by this health inequity, they're dying at higher rates, So it's like we're losing our people because they don't have the fairness of what other people have. And so that's always been my passion in the field that I'm working in, is being able to make an impact, educating our communities on health and wellness. So that's who I've been serving.
That's awesome. That's awesome. I want to also ask, ladies, so We talked about who we impact. We talked a little bit about what steps what we recommend in this role. Now I want to ask, did you all have any women mentors throughout your professional development? And if so, how did they impact your career? And I think that this is a question for all of you all because, like I said, mentorship is very important to me. And so I would say, Kanitha, if you can just start off, did you have any mentors? And it doesn't necessarily have to be a female mentor, it can be a male mentor. So just tell us a little bit about that, please.
Yeah. So thanks so much, Shatina. I think that's so awesome. And I think mentorship, as everyone has already alluded to, can really set you on the track for success. I think everybody needs to, one, we all have to pay it forward, right? Two, I think we all need someone to kind of lean on and just say, hey, I admire what you're doing. And I want to talk about when I first described my experience of really saying, what is this? What happened? And how can I help? It was after hearing a public health conversation with some of the top public health providers within Chicago. And that conversation happened at Malcolm X during Black History Month. So very similar to something like this. And we, at the time, we had the Illinois Department of Public Health's director, who was African American, the Cook County Department of Public Health, and the city of Chicago's deputy commissioner over preparedness. And they were all African American. And I remember it at the networking event just saying, hey, Kanitha, just be bold and walk up to somebody. And I walked up to someone and I said, hey, do you think you can take an intern? And really from that day, my life skyrocketed. So
Wow.
that's really how it came about. And I remember before this position I also had an opportunity to be a preparedness or disaster manager at a level 1 trauma center. And I would be networking, not seeing a lot of people like me. This job is a heavily law enforcement type of job, past police, past fire deputy. And when I would see someone, I would tend to try to attach myself to just say, hey, how did you get here? What did you do? What steps can I take? And I think that is so important. I think Tashika, I think Keisha, Beth, everyone said it, even you, Tashika, you have to, when you see someone that's like you, trust me, they did some hard work to get there and that door is open. So you should definitely, pull their coattail to just say, hey, do you have any suggestions? Because I can tell you there's a lot of pitfalls that I wish someone would have told me, but it was through, the resiliency of just being the person I am that I said, hey, you're going to keep pushing no matter what. If you're the only person at that table that looks like you, or if you're the youngest person at that table that looks like you, and so I think those type of coaching and mentorship is good for girls. So definitely I had people that I was talking to and that was encouraging me. So yep, for sure.
Awesome. Tashika?
Sure, thanks. So, growing up in this profession, I had much more exposure to male leaders. And when I started out, I was primarily on the customer service side. And a male leader I had at the time said, you know what, you've done this long enough. You need to move on so that people won't think this is the only thing you know how to do. So that really gave me my push to keep striving and keep growing in the field. However, there are women in my life that have impacted me in various ways over the years. I feel like if I start naming people and forget somebody, I'll be in trouble. So I won't go there. But as a result, I think it helped to mold me for who I am today and allowed me to grow both personally and professionally. I worked along female colleagues in which we have different strengths and different skill set, but was able to mentor each other in certain areas of our role. And in some cases, we've moved on to different roles or different organizations, but stayed in touch and serve as a support system when needed, knowing that we want to see each other be successful in whatever it is we're doing.
Awesome. Awesome. I love it. I love it. Um, Keisha?
Great. So I had to always go back to my college for my bachelor's program advisor. I was, again, I kind of told you a little bit about our story from high school. I was the first woman to graduate from college in my family. And so no one really knew how to navigate the education system like that. And so when I finished my, was getting ready to finish my bachelor's program, I went to my advisor. She's like, "What are you gonna do?" I'm like, "Get a good job." And she was like, "No, you're gonna go get your master's." I was like, "I'm not that smart." I mean, I literally said to her, "I'm not that smart." She's like, "Oh yeah, you are." And I am talking about a white, gay woman that propelled me into my future and gave me the confidence that I needed to say, I can do this. And I said, "Well, how do I do that?" She's like, "We're going to get this recommendation letter from this person. I'm going to give you one. You're going to get one from this professor. They went to Indiana University." I said, "Well, I can't pay for it. I don't have any money." She said, "You're going to get a graduate assistantship." I was like, "Well, how do I do that?" She taught me how to do that. I literally got 80% of my school, my master's program, paid for through a graduate assistantship, and then 20% the school gave me a minority scholarship. And I said I wasn't that smart, right? And so I ended up graduating from there, and then almost 20 years later, when I applied for my second master's, I was able to go back to her, and we don't talk all the time. I just went back, it's occasionally we check in. I went back to her. I was like, "I need another recommendation letter." She was like, "I got it for you." And so that is a mentor. And she was a professor in physical health education, health and wellness, community health and wellness program. And she just gave me that boost in my career that I was like, "I got this." So that's who I always have to just go back to, Dr. Cheryl Colander.
Wow, wow. Beth?
Yes, I was blessed to have worked under the same VP and director for 30 years, believe it or not. When I started in the health field, it was probably two brown girls, I'm going to say, out the entire area. I had a boss. She was tough. At times I didn't like her because I thought she was pretty tough on me. She pushed me. She taught me everything that I needed to know. And at one point I was doing her. When my VP left and went to a same company but different area, she called me. I need you to come over here with me. She brought me over there with her. That was after 20 years of service. When she moved to my last venture with healthcare at Mercy Hospital, she called me. "I got a position I need you to take over here." And I had to roll with it. So I'm honored to say I had two strong mentors, and they were Caucasian. And I know I taught them some things about racism, and they also taught me some things too. Um, to have good mentor, to have a good mentor in all my years of employment, and to keep in one is passed along, but one I still keep in touch with, and we occasionally will go to dinner. So that is important for you to establish a good relationship with your management and with your upper management, because you never know where it's going to lead you to.
That is so true, Beth. Just working here. I mean, when I started healthcare, let me just say, ladies, and this ain't, I'm not even a panelist, but I just want to add this. When I started healthcare, just like I said, starting in food services and going through the hallways and pushing that food cart and just interested in knowing what everybody role was within the hospital. I mean, that really sparked my attention. But I've had so many mentors throughout this industry. Like, it's amazing how people are so willing to help grow you. And one thing I love about like MCO organizations, because I currently work for an MCO, is sometimes they look within, and oftentimes they look within and they promote within. Most companies would look outside and bring someone in, and bring someone in over you. But that was how I was able to grow as well. And I think Tashika, Beth, you all kind of said it, but it's just basically just staying committed. I didn't have the same boss for a long time. Some bosses, were just, had to slap me on the hand. But other bosses really took me under their wings and said, "Hey, you have what it takes to be a great leader within this organization, and just the push and the motivation behind it. And I would say my last boss, and she currently works for a MCO. Her name, I'm not going to say her first name, but Miss Dixon, like really, really pushed me to say, young Black girl, you got what it takes. And I mean, that push was just like, I have what it takes. And, I really just appreciate so many women just really kind of pushing me to where I need to be. So this next question really kind of leads into the woman's role within healthcare. So I want to ask, have you seen women play a role? How have you seen women play a role in shaping healthcare? It's a lot of women in healthcare, ladies. So how have you seen women in healthcare? I mean, how have you seen women shape the role in healthcare? So, Kaneetha, if you're still on, if you can kind of pave the way and go ahead and dive into this question for us.
Yeah, I think that, again, I've been doing this about 13 years, and what I've seen is historically male dominated Caucasian kind of feel. I've seen women step up into those executive roles and really have a voice. I feel like when I started, there was just a lot of directors of nursing that happened to be women. I didn't see women COOs. I definitely didn't see women CEOs. And so, again, in my field, being a very law enforcement, military background kind of field, oftentimes, again, you're just around a bunch of Caucasian males. What I've saw over the years is, though, I saw a lot of women being promoted. And so I saw roles change as we discussed it, realizing that healthcare was just beyond nursing. A woman is just not nursing. And I could take my one of my experience at a level 1 trauma center, that COO that I worked under is now the CEO of that system on the west side of Chicago. I can take another experience from some of the grant funded work that I've done, and seeing that one of the very rare commanders from the military now work for the state and be in charge of preparedness from that way. So women are shaping it. I also just want to shout out, look at us at the national level. When you're looking at, I
Yes.
think about Dr. Corbett, who is an African-American lady. She helped make Moderna vaccination for COVID. That is super, super awesome. I see us on all facets. If you don't know, our homegrown state of Illinois people, we have 2 people on the COVID White House response team that came from Chicago Department of Public Health. 1 male, 1 woman, former commissioner. Again, every day, look at Dr. Ezike, someone that got on there boldly in the beginning of this and talked both about COVID. But then when she threw the Spanish out there for us, everybody was like, to see someone living and breathing this diversity mindset. I mean, every day I remember being just in awe, because that's not a traditional role. You don't think the worst thing will ever happen. So to see her in that facet was just so in awe. So I definitely see women on the move. This conversation alone, to be on this panel with people that have so much diversity, this is just a step, introducing new ideas, new thoughts. So like I said, I know 5 years from now, we're going to be seeing the Mean Girls right here, and we're going to be
Come
listening
on.
to them and telling them how awesome they are for just expanding even beyond what we know.
That's awesome. That's awesome. Anyone else want to chime in?
Yeah, I'll chime in. I think Kaneetha is so on point. And I'm just loving the fact that there are many more female leaders at the director and above level these days. In some instances, they go as far as the president or CEO of the organization. I can recall years ago being the only African American manager in a room full of managers and above in a medium to large size organization, say 20 years ago. Today, there are many more African American managers and above in leadership roles in health administration, and a lot more of them are women. So being in this field for just over 25 years, just the diversity in the room has done 360. It's completely different. So, but it does warm my heart to see that many more of us are moving up the ranks in healthcare.
It's amazing. It is amazing. I'm like, I chose the right industry. It's amazing. Someone in the chat
Right.
asked, what is an MCO? So I want to just take a
Yeah.
step back. An MCO is a managed care organization. So that is an MCO. Now, ladies, okay. So let me just ask you, Miss Keisha, because you are a licensed clinical counselor. You are in pastoralship too. I hear it. And you are educating the community. So, what are you most proud of in your career so far?
That is a great question. I think what I am most proud of in my career the most is that I went back and got my, I was at a, when I got my master's in public health, I was in a pivotal moment after I moved to Chicago and been working almost 15 years. I was doing good work, but I just wasn't seeing what I needed to see. One in my finances, and then I just was like, something's missing, in my career. And so I decided, I'm like, okay, am I going to go now and get a doctorate in public health? What am I going to do? Because I was also need to prepare for my future, because working for nonprofit organizations, you didn't make a lot of money. You didn't get retirement 401k plans like these major organizations and corporations. So I was feeling like I had to play catch up. So my proudest moment in my career now is that I decided to go back and got my second master's in my 40s. And so and I did it while going through a divorce. And so it just put a fire under me to like, I've got to do something for myself at this midlife crisis that I'm in. And so when I did that, I just feel like that's when my career really, really took off, and I started seeing all of the hard work that I had done pay off. So that's my proudest moment.
That's awesome. Kanitha, what are you proud of, girl? We need to know.
I, I think I've already said it. Again, my job is to think of the worst possible things and hope that they never happen. So I think to be in COVID, I am just so proud of our state of Illinois. Although I know it sometimes they're like, okay, I want to go back to normal. I miss grandma, I miss my cousins. I want everybody to have, we want to have that family reunion and more Memorial Day and the birthday parties, but truly it could have been worse. We could have looked up and been like, New York or California. We are moving from those phases. So just to be part of the fiber of, again, this unprecedented time. And again, if I can take it back to my original comments of being around 2005 when Hurricane Katrina happened, and really saying what happened and why did so many people get impacted, and then to take some of those lessons now and learn. So I'm proud of that. I'm proud of conversations like this. Again, I think we all can attest to, there were limited conversations where you saw faces, especially beautiful women faces, beautiful African American women faces, full of diversity within our own professional field. So I think I'm proud of how far we've came. A lot of more work to do. But yeah, I know we're here to stay, and we're making some major impacts out here.
Yes, ma'am. Yes, ma'am. And Beth, I don't know if your audio is fixed now, but we want to hear from you too. So tell us, what are you proud of in your career? And Beth, let me just say, Beth, you have so much experience on this panel. So you've dabbled in a lot. Like Beth, you are an entrepreneur, you are a COO, you've been in healthcare for some time. You have done a lot of great things. So what are you proud of?
I'm proud. I'm going to tell you what I'm fueled. My soul is fueled by all the young people that I have watched, that have worked in the departments under me, that have grown into adults. They have such great positions. I actually have to keep a Rolodex now of all their numbers, their emails. They call me. They call me for advice all the time. I talked to a lot of them. I had hundreds of staffs over the years, and most of them keep in touch with me. So my life is really busy with just talking to my staff from the past when they have questions. Even they have questions about even buying houses. They have questions about their finances sometimes and their jobs. And then now since they've grown so and they're intelligent, I call them for because now I'm getting a little old. I be forgetting.
So can I tell our secret, Beth? Because I know Beth because she was my husband's boss a long, long, long time ago. And from there, Beth has been like an auntie, a role model, a mentor, everything. So,
And
Beth, you are absolutely true. Right.
let me just, I met Tina's husband. Well, he wasn't her husband then. It had to be over 20 years ago. He was such a people person. And he was always late to work. And everybody, and one day I brought him in my office and I say, I'm going to say his name, Thomas. The dumbest thing you can get fired for is being to work. And I'm going to fire you soon if you don't correct that behavior. And I never had any problems from Thomas after that. And to this day, I have watched Thomas grow. I was at his wedding, have children, and he's doing such a great job. I know he'll never forget that when I told him that day. So,
that is so funny. Beth, don't get me in trouble. You can't. Don't get me in trouble now, Beth. Okay, we're gonna move on to this next question. Um, Kanitha, because I know you were trying to dabble into this in your response earlier. So can you discuss or spotlight a few common healthcare titles outside some of the traditionals that we hear, like physician, nurse? Like, we want our young people to know, like, what opportunities do they have within this industry?
Yeah, I think we've talked. I think everyone kind of hit on some of, even hearing some of the different roles, but some things to consider if you're looking at like a non-governmental agency is like a healthcare educator, and that role can expand across. You can do all types of different various educations: diabetes education, asthma, childhood education. In my role specifically, a risk manager or safety manager, and that's someone that looks at vulnerabilities within the healthcare system and how to measure those so those things won't happen. Probably a disaster recovery manager. So think about the things that are happening, that had happened recently in Texas, right? And how many people have to go out and resurvey some of the infrastructure that was lost, or homes that were destroyed by flooding and things like that. And then a public health administrator. I've heard a couple people say different masters. So like I said, I have my master's in public health administration, and that really that's kind of a big door. Again, I agree with what Keisha said. Health really, it's not a one size fit all. I think it's so diverse. And once you find your niche, whether that's a financial piece, a clinical piece, an educational piece, I think that you're able to probably, even if the title doesn't exist, create that title, right? Create why you're needed. And especially in a time right now when innovation is on the peak, to find those things. So that's just a couple.
That's awesome. And Tashika, like, there were questions in the chat as it relates to MCO. So what are some of the opportunities that individuals have if they're looking to obtain a job within an MCO?
Yep, great question. So at a managed care organization, lots of titles, lots of jobs. And one thing I'll suggest is you can always go to the career websites of these organizations. Look at open positions, read the job description so you can get an idea of what's available. But just to give you some examples today, if you're a data-driven person, most organizations need someone in health analytics to do a lot of tracking and trending of what's going on in healthcare. Billing assistants, claims examiners. Somebody's got to process those claims when you go to the doctor or the hospital. An insurance agent. Maybe you want to sell insurance to someone. And don't think to work at a healthcare organization, you have to have a health background per se. Every managed care organization needs a communications team. So you could have educational or professional background in communications and work for a managed care organization. We need attorneys. We need proposal writers. All those positions are needed at managed care organizations. So don't ever think because I don't know healthcare in particular, that I can't work for a healthcare organization.
That's good. That's good. And Keisha, in public health, what opportunities do our young people have in public health?
Mm-hmm. Kanitha hit on some of them. So I hire health educators, and most of them have backgrounds in public health. Some have backgrounds in psychology. I even have one who has a background in sports psychology. And so those are some of the things in healthcare industry. Some of the other ones I wanted to highlight. I'm a counselor. Social work is huge. And women and have been doing social work and counseling for years. And women dominate that particular profession. We are looking for more men in that profession as well. But I think about other ones like dietitians. We work with dietitians in the community and nutritionists, teaching people how to eat what's healthy for them. Other things, phlebotomy, those types of careers are also in the healthcare industry where you're drawing blood from people if you like those types of things. So those are just a few that I wanted to just highlight for the community. And physical therapy, occupational therapy, those types of positions.
That's good. That is good. You're absolutely right. We're going to wrap it up. So this will be our last question. And I want each of you to answer and give feedback here. So if you can do it all over again, like if you can just scratch it over, erase it, and do it all over again, would you choose the same career path? And let's be honest, let's be transparent. Would you choose that same career path? And so I'll start with you, Beth.
Most definitely. I would not, I could not think of anything that else that I would want to do, but most definitely.
Awesome. Kanitha.
Yeah, I agree with Beth. I think that it's not the success that makes you, it's actually the failures. So even though I'm not going to say it was an easy road, it made me the person and the leader that I am today. And I think sometimes when we have it too easy, we take for granted our ability to be better workers. I think Keisha said it best, sometimes it was like, oh my God, or even you, that smack on the hand made you that better CEO. So I appreciate the road that it wasn't clearly paved, but I would do it all over again because, again, hopefully someone behind me can just ride it out and, make a new road for the next person.
Absolutely. I love it. I love it. Miss Keisha?
So I would still be doing some of the same stuff. I would still be helping doing counseling, but I really had a desire to do sports medicine. And not necessarily maybe doing the medicine part, but I love sports. I would have loved to be working in the mental health field with athletes. And back when I started my career, that wasn't as popular. Athletes addressing and admitting mental health issues. Now it's more prevalent that they do. So I would definitely be working more in that field, but it would still be doing therapy, counseling, and community health and helping. Yeah.
And what's funny, Keisha, is that with some of the girls that we mentor in our organization, a lot of young ladies are now looking into sports medicine. And so what is, and I'm just asking this for myself, this is totally not part of the script, but what are some steps that they would need to take, or what, career paths should they take in order to enter into that industry?
Yeah, so if it's specifically sports medicine, when I told you I finished the curriculum for nursing, I actually looked at going into sports medicine at that point, but I had to take too many science classes. They wanted me to take them over. So I was like, I just didn't have the time at that moment. Like, what else can I do? But for that, the science background is always going to be, we need more women, let me say this, in STEM, science, technology, engineering, and mathematics. We need more women in that field. So they can dominate, right? So that would be getting interested in the science portion of that. And then again, just doing the research, seeing what that takes. But it's usually 4 years, and then it's medical school. And then there's the specialties, just like any other medicine. If it's more into like bones breaking, if it's more into like the physical therapy part, that's also part of sports medicine, physical therapy. If you ever seen the movie Just Right, that's a perfect example of medicine in the sports field as well. So that's just, just a little bit, a nugget of how I would say get into that field. Mm-hmm.
That's awesome. Thank you so much for your feedback. And Ms. Tashika, would you choose a different career path if you were to do it all over again?
Absolutely not. I am glad I chose this path. I dived into it and I haven't looked back. Healthcare is forever changing. So lots of challenges, and I like challenges. So I would definitely stay on this path. And I think it's such a diverse field. There's so much you can do where it's really no need to get bored. If you do, you move on to the next thing. So I would definitely choose this path again. I've enjoyed every minute of it.
And I have to agree with you, Tashika. There's so many opportunities in healthcare, so many opportunities. So thank you, ladies. Before we wrap it up, I just want to, again, thank each one of you for being able to come on and talk about your career path, give advice to our audience, our girls, their parents. We appreciate you all so much. And I just want to throw this out here. Mean Girls, we're doing a college essential drive. If you haven't heard about that, check out our website. We are giving away 100 we're giving away items to 100 college students, essential drives. So listen, it's free. If you don't know about it, please sign up. We have so much stuff. And there's so many organizations that have been a blessing and individuals that have stopped by our office to donate. So listen, there's still room for more people to register. We're almost at our 100. And if you live in Illinois, or if you are a senior in high school and you're on your way to college, you can definitely sign up for our College Essential Drive. So I wanted to just leave that out there. If you want more information about the College Essential Drive, feel free to go to our website at meangirlsempowerment.org. Thank you again, ladies, for joining us tonight. We look forward to our next panel discussion as it relates to our mothers and our daughters. We are excited to have you all, and we had a panel discussion last Thursday with our doctors. So this will close out our women's history panel conversation. But ladies, you all are definitely leading in healthcare and continue to pave the way for all women that's in healthcare. Thank you again so much for joining the panel discussion. You all have a great night.
You too. Thank you.
Thank you.
Bye-bye.